Okay, so the first underlying root cause of chronic lower back pain that I want to talk to you about today is what I believe to be probably the most overlooked and often ignored set of muscles that most doctors and chiropractors or even physical therapists such as myself just seem to miss or just simply do not acknowledge as a potential source of chronic back pain. And the group of muscles I'm referring to are a set of muscles that sit in the front of your thigh known as the quadricep muscles. So the quadricep muscles comprise of a set of muscles that sit in the front of your thigh. And even though the quad muscles are usually talked about as a set of four muscles known as the vastus lateralis, the vastus medialis, the vastus intermedialis, and the rectus femoris, I'm also going to lump into this category the muscle known as the sartorius, as well as the TFL or tensor fasciae lata muscle as seen here, because I believe that all of these muscles play a role in terms of causing some of the problems that we want to help you correct. Now, the reason why most people tend to overlook the quadricep muscles as a potential source of back pain is because most people associate the quadricep muscles with knee function. And while this is true because all of these muscles play a huge role in terms of allowing us to do things like, run and jump and squat or go down a flight of stairs, the thing that most people seem to underestimate about these muscles is that they don't just attach onto your knee, but they also have very important and critical attachments also onto your pelvis, specifically this rectus femoris muscle, the TFL, and the sartorius muscle as kind of seen right here in this diagram. And the reason why it's important to understand these attachment points is because the pelvis serves as the foundation for your spine. And if the foundation for anything is off or crooked, it's going to set everything that sits above it up, it's going to set up for failure. And what's going to happen to most people, when these quadricep muscles start to get tight, either because of too much sitting or too much driving, or just due to lack of stretching or the fact that people aren't paying attention to these muscles, is that these muscles will actually start to form knots or start to form kinks within the muscle. So if I use this orange band here just to kind of signify what happens to a muscle when it gets tight, as it starts to form, a couple of knots or a couple of kinks within the muscle, is the first thing you're going to start to notice is that the length of the rope or the length of the band is going to start to shorten, okay? And what happens to the two attachment points when the muscle starts to shorten is that the two attachment points are then going to start to get pulled closer towards one another. So if I have one attachment, in the front of at the top of my pelvis being pulled down towards my knee, then what's going to happen is the pelvis is going to start to get pulled forward into this forward position like so. Okay, so as my pelvis starts to get forward, tilted forward into something known as anterior pelvic tilt, what's going to happen is my entire body is then going to start to get pulled forward as well. And since this is an awkward position for me to be in, especially if I want to be able to come up straight, then what's going to happen is if I don't correct what's happening at my hips and through my pelvis, and if all I do is just try to get up straight, what's going to happen is I will have to overextend from my lower back just to get up straight because of the tension that's being placed upon my quadricep muscles. And this is going to cause a position within my back where it's going to be overextended, known as hyperlordosis. And this is the posture and this is the position that I find that so many of our patients tend to get stuck in, which can usually cause a lot of back pain, specifically with people who have struggled with standing for a long period of time, or it could also even cause problems for people that are trying to walk for an extended period of time. And it can also create this perception that you're being pulled forward in this like stooped over position. However, despite all of this, the good news is that this is a problem that's actually very easy to fix. And for so many of our patients, when we have been able to identify, tight quads as one of the underlying problems, and then when we give them the right strategies and exercise to fix it, can just be one of the absolute biggest game changers in terms of how much stress and pressure and tension will be lifted off of your back. And as a result, you also might start to notice not just, in terms of decreased pain, but also just an ease and just a lot less effort in being able to do things such as, standing up to cook dinner for your family, which can be difficult, or just being able to go for a long walk, or just be able to stand comfortably without this constant feeling or pressure or tension kind of building up in your back. So what we want to do next is to show you a couple of very simple ways that you can just self-assess to see if tight quadricep muscles are your underlying problem. And then if you have identified this muscle as one of your issues, then we're going to show you some of our favorite strategies on how to fix it as well. Okay, so with us today is my wife Twee, and she's going to be helping us through some of these stretches and exercises and some of the demonstrations today. All right. So the first thing that we want to do is to show you how you can perform a very simple self-assessment to see if tight quadriceps could be your underlying problem. Now, all you need to do to perform this test is to first hold on to something for balance. Twee here is using a foam roller, but you can use a chair, you can use a counter, you can use a tabletop, just something sturdy that you can hold on to for balance. Now, the next thing that you want to do is to first grab onto your foot and try to pull your heel towards your buttock, like so. And then the next thing that you want to do is to try to then point your knees straight down towards the ground, like so. And most importantly, you also want to make sure that your back is staying completely straight, and also so that your hips and your pelvis are staying level, which means that it should be parallel to the floor and parallel to the ceiling. So if you're able to accomplish all four of these tasks, then this is what we would call a passing test, and that tight quadriceps are unlikely to be the problem that is causing your back issues. All right. So Tweet, go ahead and reset. Now, if you are someone who does probably have some type of tightness or tension within your quad muscles, then what we want to show you next are some of the types of problems that you expect to, or that you're likely to run into. And then you will be able to visibly see how tight quads could actually be contributing to your back issues. All right. Now, the first thing that might happen if quad tightness or if knee problems are your issue is that you might have difficulty just simply grabbing onto your heel. All right. So if this is happening to you and that you're just the attempts of you trying to kind of grab on, that you just feel like you can't, hold on, then this is the first sign that that tight quads could be an underlying problem that you have, or that you might have some underlying knee issues that you want to address. So if you can't just grab on, then that's okay. Then you can just kind of move on to the next part of this video and start to get to work on fixing some of these issues. All right. Now, for a lot of people, they generally don't have a difficult time grabbing on, but when they start to grab on, the first thing that may happen is their entire body starts to get pulled forward, like so. Right. And this is because of, again, as we talked about before, the very important attachments that these muscles have onto your pelvis, and that when these muscles are insanely tight, that they're going to want to pull your entire body forward. So if you start to put this muscle under a lot of tension, and if you start to feel that your entire body is being pulled forward, then that is, again, a very clear indicator that tight quads could be your underlying issue. All right. So Tweet, go ahead and reset. Now, the next thing that may happen is, if you've been able to identify that, man, I'm starting to get, pulled forward by these muscles, then the next thing that's going to happen is you're going to want to start to try to get upright. So what's going to happen here is, instead of being pulled forward, if you try to force this position where you try to get upright, then what's going to happen is you may start to overarch and overextend your lower back, like so. Right. And this is probably the most common issue that we do see, where somebody's back is just kind of overcompensating for the tightness within these quad muscles. So again, if this is happening to you, then again, this is a very clear sign and indicator that tight quads are an underlying issue that needs to be addressed. All right. So Twee, go ahead and reset. So now that we've identified, being pulled forward or overarching your back as, some underlying issues, what's going to happen is, if we can correct for these issues, this is what you may seem will happen. So Tweet, go and grab on. So in order to make sure that you're not leaning forward, try to get upright, but then you also want to make sure that your hips and your pelvis are staying completely level. And when this happens, what's going to happen is your knee might start to get pulled way up and forward, like so. Right, because of the fact that you're keeping your back in place, you're keeping your pelvis and hips in place, and now we're really starting to isolate the potential tightness within those thigh muscles, and then you're going to again start to see your knees start to pop forward. Right, and once this happens, again, you can then start to measure the angle in which your knee is kind of far away from just kind of being straight, like so, and that is the amount of distance that we need to be able to correct in order for us to eventually help you get to a passing test. Okay, so Tweet, go and reset. So again, let's just go over what it should look like for a passing test, just to make sure that this is what we are kind of looking out for, to make sure that these tight quads are being addressed. So again, make sure that you can grab on your heel onto your butt. Make sure that your back is staying completely straight. Make sure that your body is upright, and also make sure that your hips and your pelvis are completely level. so that your hips are parallel with the floor and the ceiling. So if you're able to do these 4 things, this is a passing test. But if you have difficulty accomplishing these things, then that's okay. That's what this video is for. And now we're going to show you some of our favorite ways to help you start to correct some of these issues to eliminate the level of pull and tension that tight quads may be having on your back. Okay, so the first thing that we want to show you in terms of how to fix and release some of this tightness or tension you may be finding within your quadricep muscles is to teach you how to properly use this foam roller device here. All right, now the foam roller device is one of the best ways to start to release a lot of the knots or a lot of the kinks or a lot of these tiny little restrictions within the middle of the muscle that could be what's causing the muscle to be so tight all the time. All right, so what Twee's going to do is she's going to start by laying on the roller using on top of her right leg. And she's going to just kind of start right on the top of her hip or right on the top of her pelvis, right where a lot of those quad muscles seem to attach at the top. And then from there, she's going to do a very slow roll right down the center and just maybe slightly off to the side of her quad muscle. And the thing is, she's just rolling very, very slowly down the roller. And all she's trying to do is just kind of scan to see where the tightest and most tender spots of her quad actually are. All right, and you may feel when you perform one of these scans that you might start to feel a lot of pain or a lot of tenderness or a lot of tightness within the muscle, but you may start to realize that there are some points that just feel a lot tighter and a lot more tender than the other spots. Right now, Tweed, go ahead and stop and pause once you've kind of found one of those spots there. All right, so Tweed's on one of these spots, and we generally call these spots a trigger point. All right, a trigger point is just an area of the muscle where there's a lot more just kind of tightness and just kind of contraction happening. And once she finds one of those spots, she wants to stay right there. All right, and then just from there, just take a couple of nice deep breaths and just try to relax the pressure into the roller. This is going to feel quite uncomfortable in the beginning. It's going to feel quite painful or quite tender, and it's going to feel like you just want to kind of get off of these spots as soon as possible. But I assure you that the most effective way to actually get these knots to release is to first identify them and just to use your deep breathing as a guide to help you release the pressure and the tension within the muscle. Right, and by learning how to release these trigger points, you will inherently be able to release some of the knots that are embedded within the muscle. And once these knots start to release, then it's going to help you restore the length and the flexibility of this muscle way faster than most people can think. All right. So, you can spend about 5 to 8 deep breaths on a trigger point, and then once you've released one, then just kind of work on to the next. A lot of people that have a lot of tightness with this muscle may realize that there are several trigger points, within the muscle. So it may take, several minutes for you to release some of this tightness, or it might take a couple of days or even a couple of weeks for you to start to get used to the technique. But I assure you, if you just take this technique very slowly, if you just kind of work on it gradually over time, but are able to still work on it consistently, then I assure you that you can expect to see some noticeable changes within the tension within this muscle, sometimes again within a matter of days, or at worst, just within a matter of a couple of weeks, right? So Twee here, she's just kind of working through each trigger point. She's, pretty expertly skilled at doing this type of stuff since she's a trigger point massage therapy specialist. So she kind of knows how to identify knots and just kind of use her breathe to release into them. But this is kind of what it should look like. All right. So 3, 2, 1, go ahead and reset. All right, and we always recommend that you also perform this technique on the other side as well, and to not just work on one part of the muscle. You can also work on the side of your leg to kind of work on the outer quad or the outer thigh, or just kind of spend more time kind of working right down the center as well. Again, just get used to initially just kind of scanning all around the muscle, again, front, sides, and kind of in the middle, just to find where your pressure points or where your tender points are. And again, the most important thing is to be able to locate and isolate some of those trigger points, and just spend some time just learning how to breathe and just kind of relax into the pressure. And again, over time, that will help you release a lot of the tightness within the muscle, and that should again help restore your flexibility very fast and very quick as well. Okay. All right. So that is it for the initial foam roller release technique. Now let's get into showing you a couple of ways that you can start to stretch the muscle without hurting your back as well. Okay, so the next exercise we're going to show you is a stretch that you can perform while using a yoga strap. that we're going to do off of the this table that we have here. Now, this is the version of the stretch that I think is probably the best to do if you have a lot of back problems, because it is the safest to do on the back. It just requires a little bit of a setup in terms of being able to put one foot flat on the floor like Twee, and then from there using the strap to try to pull your heel towards your butt like so, right? Now, the reason why we like perform this stretch with one foot flat on the floor is because it kind of stabilizes your pelvis and allows your back to stay completely flat and completely straight, and really forces you to just kind of isolate feeling the stretch that you get within the thigh, while making sure that there are no unnecessary stresses going into your back like so. All right. So once you kind of get into this position, and again, you can perform this either off of the edge of the bed or sometimes off of a sofa, just anything that kind of gets your your one leg kind of flat, and while you can focus on stretching the other side. And it's that once you start to feel a stretch within your thigh, just kind of by pulling your heel closer to your butt, just kind of stay right there for a couple of seconds and take a couple nice deep breaths in. And on your exhale, try to just kind of pull your heel a little closer towards your buttock, just to increase the level of stretch that you get within the muscle. Now, with all of the stretches that we want to show you, you'll hear us repeat this time and time again. We really want to focus on your breathing, because breathing is what will essentially allow you to be able to release some of the tension within your nervous system, which will allow you to get into a deeper stretch. All right. So again, Tweet, take a nice deep breath in. And on your exhale, just try to pull that heel a little bit closer towards your buttock, like so, and just hold it there for a couple seconds. And you want to repeat this for about 5 to 8 breath cycles. Just to make sure that you're getting used to just kind of counting your breaths instead of just kind of holding the stretch for 30 seconds. All right. And again, just try to get into the habit of using your breathing as your guide, just to kind of guide you through the stretch. All right. It might take a little bit of time at the beginning, but the more you practice it, the more you start to really feel the level of impact that breathing will have in terms of increasing the level of stretch that you get. Let's do it one more time. Deep breath in, exhale, and just push a little further into the stretch and hold it there. 3, 2, 1. All right. And then we always recommend that you perform this exercise on the other side as well. And so that is the first stretching exercise that we recommend that you perform after you've performed a nice, thorough foam roller release of those quad and of those thigh muscles. All right, so the last stretch we want to show you is to show you how to perform the stretch back into the standing or testing position. I think that performing the stretch in the standing position, the testing position, is probably my favorite way and preferred way to actually stretch these muscles, because I think it's the most effective. But for those of you who might be struggling with just the testing position, try one of the first alternatives, but then to try to revisit the standing position, just to one, check to see how much progress you've been able to make, and two, if you can actually start to get a good stretch while in this position, then this is probably actually my favorite way to actually stretch the thigh muscle, if you identify it as being tight. All right, so Tweed just kind of went over how to perform the stretch. So let's kind of walk you through it, just kind of step by step. All right, so just start by just kind of grabbing your foot with your hand, bringing the heel towards your butt, just like we talked about in the testing position. Again, make sure that your back is staying flat and that your pelvis is staying level. And you're going to start with your knee at kind of this like forward flex angle with your hip and a little bit of flexion. And then most important thing is, once you start to feel a stretch within that thigh muscle, stay right there and just take a couple of nice deep breaths in. And on your exhale, just try to slowly point that knee just a little bit further towards the ground, just to take up a little bit of the slack, and then hold it there for a couple breaths. All right. Again, with all the stretches that we showed you, you want to make sure that you use consistent breathing as your guide. And on your exhale, to try to increase just the level of the stretch that you get, and just to be able to point that knee further towards the ground over time. All right. And let's practice that a couple more times. Deep breath in, exhale, push down a little further towards the ground and hold it there. And just one more time, nice deep breath in, exhale, point a little further towards the ground. Hold it there for 3, 2, 1. All right, let's just test one time on the other side. All right, always important that we do this stretch on the other side as well, for you to check to see if there are any asymmetries from side to side. Right, and make sure that we're, again, just kind of being balanced and being thorough and make sure that we're working on our whole body. All right. So again, make sure that the back staying flat, the back is staying straight, the hips are staying flat, and your knee, if it's really tight, or if your quad is really tight, your knee should be at a forward flex angle. Then our goal, obviously, again, is just to point that knee as far as we can towards the floor while keeping the back straight and keeping the pelvis level. All right, nice deep breath in. Exhale, point the knee a little further towards the ground and hold it there for a couple nice breaths. All right, take your time with this. Don't expect to see big significant changes within just a session or two, but I assure you, just kind of practice this over time, and just try to make just small steps and just small progress over time, and you will start to see that that knee is going to start to be able to point a little bit further towards the floor. And I guarantee that by restoring the flexibility within this muscle, it's going to take a tremendous amount of stress and strain off of your back. Right? So nice deep breath in, exhale, and point just a little bit further towards the ground, and hold it there for 5, 4, 3, 2, 1. All right, so that is it for our little program to teach you how to first assess to see if tight quadriceps could be the underlying issue that's causing your back issue, and then to show you some of our favorite ways that we've been able to help our patients be able to correct some of these problems through their own exercise methods and techniques. All right, so that's it for this video. I hope that this helped, and we hope to see you again next time. Take care and have a wonderful day.